Welcome back. Gunderson ophthalmologist Suzanne Falkenberry joins us in studio today to tell us about glaucoma and blindness. Thank you so much for joining us today.
Thanks for having me, Eric.
So, first, explain exactly what is glaucoma.
Okay, well, glaucoma is damage to the optic nerve, which is the nerve that's in the back of the eye that leads from the eye to the brain. For the most part, it's caused by high pressure, but not everybody with glaucoma has high pressure.
So, who is at most risk for developing glaucoma?
It's definitely, for the most part, a disease for older people, but definitely younger people get it as well. But we do recommend that people start having routine eye exams at about age 40 so we can make sure that you don't have glaucoma.
Now, does glaucoma run in families and whatnot?
It often does run in families, so if you have a family history, you should definitely make sure to get that eye exam.
So, in order to check for glaucoma, what are you looking for? What do you have to come in for an exam for?
So usually we just start with a routine exam where we would check your vision, check your eye pressure, and then also look at the optic nerve in the back of the eye.
So if we find out that someone does have glaucoma, how can we treat glaucoma?
So generally, even if you don't have high pressure, the way that we treat glaucoma is to lower the pressure in the eye. So for the most part, we start people on eye drops. If the eye drops aren't working or people are having a problem with the eye drops, we can go to other therapy like laser and surgery. But for the most part, eye drops.
So when you talk about glaucoma and we're talking about blindness, a lot of people may be concerned about that. When should we be concerned about blindness in glaucoma patients?
Well, in general, if we can catch it early, most people don't lose vision from glaucoma. But certainly that is a risk of glaucoma. The later we catch it, the more likely you are to become blind from it. So the earlier we can catch it, the more likely we are to prevent it.
Is there anything that anyone can do that can help maybe reduce their risk?
It's a good question, and I get that question all the time. Unfortunately, there's no diet or exercise that you can do, but basically just come in for your exams, and if you do have glaucoma, take your medications regularly and can come in for all of your follow-up appointments.
All right, well, thank you so much for the great information. Really appreciate it.
Thank you.
We'll have one final look at your forecast after the break.